Welcome to the knee class exercise video with the Physiotherapy Outpatients team. We are going to show you 5 exercises. Exercise 1. Knee hangs. Sitting on a chair with the leg to be exercised supported on a chair as shown. Let your leg straighten into this position. Try to relax the muscles to enable the knee to get as straight as possible. A weight such as a bag of vegetables or using double oven gloves with tins in the hand pockets can be placed above the knee to help apply more pressure and straighten the knee further. The aim of this exercise is to get the knee totally straight. If you can't get it straight, you can do this exercise for longer than the 1 minute suggested. Anything up to 20 minutes if you can tolerate it. When you go to bend your knee again, it will be sore. This is normal. So gently ease the knee into a bent position after it has been straight for some time. To help relieve any swelling, elevate the operated leg up with pillows whilst lying on your bed. Make sure your foot is elevated above the level of your heart. At other times, sit normally in a chair with your legs down to allow your knees to bend. Applying ice to the operated knee after your exercises will help to control the pain. Apply the ice for 20 minutes every few hours and continue to do this for the full 6 weeks and if the knee feels warm after the 6-week period. Exercise 2. Knee bends. Sit on a chair with your feet flat on the floor. Bend your operated knee as far as you are able to. Once you have gone as far as you can on your own, use your good leg to assist the movement further into a bent position, as shown. This exercise will be sore to perform but will become easier as you heal post-surgery. You are aiming to bend the knee so that your foot is under the chair. This will make it easier to perform everyday tasks such as getting up from chairs and enable you to ride a bicycle. Try make it so that every repetition the knee bends a little bit more. Start easier and make the last few a real effort. The pain levels really do vary from patient to patient. Patients with adequate pain relief recover more rapidly. It is therefore important that you take your painkillers at regular intervals. Also, please don't forget that ice packs will provide additional pain relief. Significant pain gradually settles over the first 4 to 6 weeks. Milder pain continues to resolve for up to 12 months following surgery. Exercise 3. Seated knee extensions. Sitting in a chair with a good back support, place a ball, pillow or cushion between your feet. Slowly pick the ball up with both feet and straighten your knee. Hold for a brief moment with the knee straight and then slowly lower back down to the starting position. You are aiming to get the knee totally straight with this exercise. As you strengthen, this exercise will become easier for you to get the knee straight. Once this is the case, you can challenge the thigh muscles to work harder by holding the ball in the air for longer. Remember to keep your breathing going throughout this exercise. There are no restrictions to your diet. Bear in mind that you have just undergone major surgery, so make sure you eat plenty of fruit, vegetables and lean meat for protein and iron. Try to drink 6 to 8 glasses of water a day. If you have lost weight, try to keep it off. It will reduce pressure on your new knee and help you to undertake your exercises more easily. Exercise 4. Sit to stand. Sitting with your arms crossed. Slowly stand up and sit down on the chair. If initially you find this difficult, find a chair that is slightly higher or use your fingertips to help guide you off the chair, but do not push through your arms. To make the exercise harder, you can sit on a slightly lower height chair. A further progression after chair height adjustment is to increase the number of sit to stands that you can complete in the minute to challenge your fitness levels, or increase the length of time you perform the exercise for. For the last exercise, you will need to be in front of a small step or be at the bottom step of the stairs. Use this time to get yourself into position. Exercise 5, step-ups. Stand in front of a small step or the bottom of your flight of stairs. Step up onto the step leading with your operated leg. Pause on the step and step down off the step again with your operated leg leading the movement. This exercise can be made more challenging by increasing the height of the step you are stepping on and off. Once you have done this, a further progression will be to increase the pace of the step-ups to challenge your fitness levels, or increase the length of time you perform the exercise for. If you have any questions or concerns at any point regarding your exercises, please don't hesitate to contact us on the number provided on the screen. For any other questions or concerns, please contact the SWAT team. All available contact methods are currently on your screen.